Are you suffering with acidity or acid reflux or gastritis or heartburn? Then this video is for you. Today I'll be talking about what are the causes and what it is, what really happens to your body when this kind of symptoms hit you. Of course, if you're taking any kind of gastric tablets or any kind of eno or some jeera juice, anything, jeera tea, anything, and you're not getting any kind of relief, why it is and what can really make you to be completely free from all this kind of symptoms, because in day to day life this has been the very common disease which is affecting the day-to-day life of the individual. First of all, most probably the middle age and the younger people. Okay, before I enter into the introduction of acid reflux, I'll introduce myself because that is very important. I'm Dr. Megashri from Homeopathic Clinic. I'm an practitioner of homeopathy from 5 years, and I treated plenty of gastric symptoms or gastric problems which was really troubling the patient. And I'll be giving some of the regularly used homeopathic medicines which are really not required prescription for you guys to take it, because you can just bring that and keep it in your home whenever you feel like, okay, I'm getting this kind of symptoms like heartburn, indigestion or bloating or difficulty, and there is some kind of erectations or gas formation or sore erectations. That time you can just take 4 pills and you can just relieve it, just how you take the pandy or some other gastric tablets. Okay, because homeopathic medicine does not have any kind of side effects and you can use it by closing your eyes. I can guarantee you on that. Okay, first we will know about what it is, why it has been acting like this, and what are the causes, what is the definition, and how we are suffering with this. Because you will be having a question, I hit the same thing and my sister hit the same thing, but I am the only one person who is having this gastric trouble. My sister is okay with it. Why it is so? So many people says that why me? I have an answer for you in this video. Watch the video till the end and don't forget to. First, we will be talking about what is why you are feeling like this. It is because the acid secretion in your body is normal. It is not more, or it is not kind of acidic like that, because some people imagine that the acid secretion in our body has been increased, because of that I am getting this acidity or gastritis and I should reduce that acid secretion. No, it is not like that. What happens here is, between the stomach and the esophagus there is one kind of gate like thing which always release the food which we take, which goes from the esophagus to the stomach in one direction. Means from the stomach to esophagus it should not come back. Okay, but for some people that kind of means esophageal sphincter muscle does not act properly. Because of that there is an acid secretion which goes to the esophagus from the stomach. Because of this some people suffer with the acidity, gastritis and everything. And what happen with others is that if they are eating much more number of unhygienic food like salty food, oily food, or the foods which are more of preservatives like that, of course they also have indigestion problem. Because of that they get this kind of symptoms. Or some people what they do is they just kind of eat the food and just lie on the bed or sit without even the movement. Because of that also it happens. And some people do is that the posture of eating, means some people use their phone while eating. This also depends upon the digestion, because you are acting very, means you're not putting your head down while you're eating, and that is an wrong position while you're eating, because you are watching the phone and you're not concentrating on the plate, and you are in the wrong direction. Because of that also it happens. And some people also kind of does not chew well or does not eat well. They kind of, means they will be starving for 3 to 4 hours, immediately they eat the spicy food. They does not drink water, or they does not take any kind of mild food. Little bit after that they can take the food which is necessity. Leaving the stomach empty for the longer hours also causes the acidity and gastritis and indigestion, bloating, everything. And some people also kind of, because of this bloating, also suffer with the constipation. Some people come, they say that I'm unable to pass my stools, but I know that it's in my stomach and it's troubling me. I does not know, doctor, why it's not coming out. Please get rid of this symptom for me. Because he will be unable to concentrate on his work life, because he will be always concentrating on, okay, what if, means morning he wakes up, after waking up he will be thinking like, okay, I'll be passing the motion, but the motion does not come. So he thinks that, okay, if I eat the breakfast, it will come. But after eating breakfast also it's not coming. After drinking coffee also it's not coming. He gets a little bit of fear. What if I'm in traveling for office, that time if the urgency comes, he will be having that fear, and with that fear only he leaves for the office. And in the office he will be thinking like, okay, I may get the urgency now, I may pass the stool now. Till the day finishes he will be having that thought only, because of this insecurity. And because of this fear he will be unable to put his mind in anything which is going around him, and he will be always kind of concentrating on this kind of thing only. Because of that, he cannot give his best. He will be having the knowledge of his work, but he cannot give his best because he is concentrating on this. He will be very lazy and everything. So what you can do to correct this kind of things is that eat an regular meal, balanced diet, like take salads like cucumber, uh, veggies, anything. Or you should also eat after the food curd. Little bit of probiotics is also needed, okay. And another thing is that you should always drink more number of water. Nowadays the people are not at all taking water. Hydration is much and very needed for us. So drinking water is very essential if you are suffering with this kind of symptoms. Okay, first thing is hydration, second thing is eating balanced diet. You just kind of find out which food is okay for you, which food, after eating which food you will be all right, and after eating which food you're getting this kind of symptom, you better avoid that, okay. Next one is that meal time. Every meal time should be, means in the morning you'll have at 11:30 and you'll have a afternoon at 3, like that. No, it should not be like that. It should be on time, okay. And night, what you should do is before bedtime at least 2 hours, if you cannot at least 1 hour, and at least half an hour if you cannot also. After eating, at least do 10 minutes of slow walking. Don't lie down, okay. This will really kind of be helpful. This is all about the management, how you can really correct it. And I'd already said previously, before starting this, after starting this video, that I'll be giving some important tips from homeopathic medicine, which you can keep with you always as an emergency medicine. Whenever you feel like that, you can just take it out. Of course, I remember that I'm going to give you guys that. Okay, first note on, first remedy is I always give for my patients for keeping it for you always, means without even my asking me, you can just take it. That is carbo veg 30, because it is one of the best and most used medicine in homeopathic practice. Okay, carbohydrate 30, when I should be taking, you can take in the empty stomach or after eating. If you're feeling discomfort, you can take how many times I should be taking. Better take one time, and if the symptoms are been not okay with you, take twice, thrice, only 3 times a day. Okay. Next one is Naxomica. You can take Naxomica 30. Naxomica 30 should be taken only once in a day, and uh, before the meal. If you take it as an wonderful result. Okay. And if you are suffering with so much of gas formation and all, you can take Lycopodium, but preferably I give Carbovage and Naxomica. Thank you.